working in a trauma center, 2005, up in northern Florida, and we had a trauma patient that came in. The patient later passed away due to injuries from his trauma, but the patient had AIDS. And while we were working on it, the trauma room was overcrowded, and I had an occupational exposure and was infected with the patient's HIV virus. Immediately after that, occupational nurse came down, drew my baseline labs, and basically we went from there. Initial labs came back as negative. 3 months into it, the labs came back negative. At 5 months, they came back inconclusive. At 9 months, they came back inconclusive. And people in northern Florida, they couldn't figure out why they were coming back inconclusive, so they decided to refer me to the Mayo Clinic in Jacksonville, where I went there, and it was, I think, Christmas or January. Would have been January of 2006 at that point, that positive diagnosis came back. They took the labs, sent them to Rochester in Minnesota, and a day later I had a phone call from the doctor there. Never in a million years thought that I would actually be facing this, an occupational exposure. I mean, you hear about it, you learn about it, you go through the steps to avoid it. You just don't hear too much about that. I went through a stage where I felt I wasn't doing drugs. I didn't have a bad blood transfusion. I wasn't having promiscuous sex. I wasn't doing anything like that. I felt I was just getting up, doing my job, and that is what I received in return. So it was very hard. The only difference I've ever noticed was from an internal medicine doctor back in 2008, when I had just a regular garden variety pneumonia. And when he found out that I had HIV, he came into the exam room, and he was wearing a full surgical outfit. He put on 2 pairs of gloves, and he put on gloves over a stethoscope. He put on a mask and a face shield just to give me an examination. And that was the only time thus far that I really felt, smaller than a microscopic organism on the bottom of a shoe. That somebody in the healthcare field that has the knowledge of how this is transmitted and the perception that he does would treat or even have the audacity to approach a patient like that. For the longest time, I wanted to either go into trauma or ER, something along those lines, be a medical director of an ambulance service. That's how I started. I started on an ambulance when I was 18 years old. Just loved it, just had a true passion for emergency medicine. And, I was infected in 2005, but it really wasn't until 2007 that I said, I think I want to do something different. And I think going into infectious diseases not only puts me on the front lines of this virus, this pandemic, but it also gives me the opportunity to sit across from somebody else that is living the fear of either not knowing or the fear of handing them a positive result, and being able to look them in the eye and say, no, I do know what you're going through, and I do know the fears that you're having, as opposed to so many doctors out in the world cannot relate like that with so many of their patients. And I feel going into that area, that will just put me on the front lines and be able to use this virus that has affected me to help even more people than I could possibly imagine in emergency services. And we don't have answers for why. Even if it was risky behavior, nobody deserves to have HIV. An IV drug user, they don't deserve to have HIV. A spouse cheating on somebody and then transmitting the disease, they don't deserve that. Nobody deserves it. They don't. But it does happen. And again, It's what you do with that. What's going to make the path for the rest of your life? Are you going to let this destroy you and destroy your future, your goals, your dreams, your life? Or are you going to do something with it and continue to live your life? It can happen. It will continue to happen until one day we hopefully find a cure.